Hi guys, welcome to Sex After Dark.
Thank you so much for joining us.
Thanks for joining us. My name's Aiden. I use he/him pronouns.
I'm Theo, he, him pronouns.
I'm Alessandra. I use she, her pronouns.
Lily, she, her pronouns.
Yeah, sweet. We're gonna talk about sex.
Yeah. All right, we're gonna step out of frame and let Theo take over.
All right. So we are the Office of Health Promotion, and we do programming and education related to safer sex, substance use, and self-care. So we're gonna start off with what's said here stays here, what's learned here leaves here. And that basically means that if anyone shares anything personal with the group tonight, we're gonna keep that within the walls of this building. But share everything that you've learned with other people, share it with the world, share it with your friends. This is good information we want everybody to have. And the next three are all pretty connected, but don't yuck another's yum, keep an attitude of sex positivity and acknowledge that all relationships look different. And then make space, take space just means if you have something to say, take up space, feel free, say your piece, but also allow other people to take up space as well. And that's it. If anyone has any suggestions, shout them out. Anything to contribute, that's okay. If you're having a moment or anything like that, do what you got to do. You can leave the room. You can zone out, take a break. We totally understand that. Just feel free to rejoin us whenever you're ready.
Okay, so now we're going to talk about consent, what it is, how to ask, and some resources for you guys. Okay, cool. So now we're going to talk about what is consent. Consent is a yes that is freely given when the option of no is both present and viable. So this just means that you're not under any coercion and you're saying yes under your free will and you have the ability to say no. It is an ongoing conversation between you and all of your sexual partners during your sexual activity. It is given in a sober, enthusiastic, clear, mutual, and specific way. So sober meaning you're sober enough to drive a car. Enthusiastic meaning it's like a hell yes, I definitely want to have sex. Clear meaning that you know what you're getting into, you know your partner's STI status, you know if one or more of you guys wearing a condom, who all is gonna be in the sexual activity. Mutual meaning that everybody's on the same page and you all have a clear understanding of what's going to happen. And then specific way meaning that you know what you're going to get into. And then it's communication amongst you and all your sexual partners. Okay, so this is a little acronym to help you guys remember. It is FRIES, so freely given, reversible, informed, enthusiastic, and specific. Just going over all the same things. So freely given, you're not under any coercion. Reversible meaning given is a yes, I like that. Let's do X and then we can do Y. Definitely thumbs up. Oh yeah.
Oh, yeah.
And then my favorite is hell yes. And then consent not given is I'm not sure, silence. I guess, no, or not right now. If it is silence, it is always a no. So these are some examples of, yes, you have consent, go ahead with activities that you already discussed. And then this is, you don't have their consent, so you're not allowed to do anything. Okay, so how to ask for consent. Start an ongoing dialogue. Talk about what you do and don't want to do. If there's any fantasies that you want to explore, would you want to do X first? And then we can see if you'd be down for Y. So talking about what you would be okay with doing, what you want to talk about doing. And then before we start, your hard limit is X. My hard limit is X. What are yours? So we use kind of like a stoplight metaphor in this. So for our stoplight, red would be, no, these are my hard limits. This is what I don't want to do. Yellow would be, okay, we can talk about this, what some of my boundaries are. Maybe we can say if we do it. And then green is, yes, I do want to do it. Let's go ahead. And then be direct and ask your partner what they want. So asking, can I kiss you? I like it when you do X. Do you want to do that? What do you want to do? What word would you like me to describe this part of your body? Because some folks have gender dysphoria and asking about what they would like certain parts of their body to be called can be really affirming for them. And some people don't like certain words. So like using the word pussy, some people don't like that. Some people also don't like the word cock because that sounds kind of off. So asking about what would be good words to use for their different parts of their body and making sure everyone's being respected. And then lastly, check in frequently. So asking, are you having fun? Does this feel good? Do you want to switch positions? maybe checking if someone needs a drink of water, if you have to go to the bathroom, if you want to go eat. All good things, so making sure everybody's having a good time. And then see, these are some sexual assault resources. So on campus, that ones that are confidential was ASAP, the Counseling Center, the Psychological Services Clinic, and then Student Legal Services. And then the ones that are on campus but are not confidential are the Office of Institutional Equity and Compliance, Dean of Students Office, Student Outreach and Support, and then the Disability Resource Center. And then the options in Greeley that are confidential is the Sexual Assault Victim Advocate Center, or SAVA, Planned Parenthood, North Colorado Medical Center, and then North Range Behavioral Health. Yay, so now we're gonna have Aiden talk about STIs and pregnancy.
All right. Hi, guys. I'm here to tell you about STIs and pregnancy. So let's talk about it. So there's different types of STIs. There's either bacterial or viral. So just some quick, a non-exhaustive list. Viral infections can include herpes, HPV, and HIV, and then bacterial infections include chlamydia, gonorrhea, syphilis, and trichomoniasis. So the difference between these two is that, we'll talk about that in a bit. But you may also hear like STDs or sexually transmitted disease. We tried to kind of phase that term out because it kind of implies a negative connotation of having an infection. But sometimes it can be a disease if it's left untreated. And yeah, so let's keep going. What's up?
What would like crabs be under? Would it be viral?
That's parasitic.
Crabs are parasitic. I didn't even know that. Well, there you go. All right, so fun fact, people aged 15 to 24 account for almost half of new STI cases. So adolescents and young adults are the most at risk for contracting an STI, but thankfully, that's what we're here to do. We're here to help you to help you know how to protect yourself. So some general symptoms to watch out for. A lot of them kind of intermingle between infections. Can include rash, irritation, itching on genitals or anus, irregular discharge from vagina, penis, or anus, and then some like warts or weird like discolorations anywhere that you've had sex. And so the thing about treatments, I mentioned before, the difference between bacterial and viral is that bacterial infections can be cured, usually through antibiotics or topical creams. It usually takes a couple weeks to go away. But virals cannot be cured, they can be managed. And so antiviral drugs help. So for things like HIV, you would be using PrEP or PEP to make sure that your viral load is undetectable so that you cannot transmit HIV if you have it. All right, but the other thing to consider is that the most common symptom of STIs is no symptom. So it's very important, right? It's really important to make sure that you're getting tested frequently with every new sexual partner. And so, yeah, so let's talk about how you can prevent the spread of STIs. So getting tested, like I said, before each new partner, or a general practice can be like once a year. If you test positive, make sure you seek treatment and also make sure to communicate with your partners. Yeah, like discuss your status with any new partners that you may encounter. Use barrier methods. We'll talk about what those are in a second. And then decrease the stigma of STI testing and treatment. So when somebody asks you, like, what's your STI status? We like to encourage people not to use the word clean, because that implies that people with STIs are dirty and gross, which they are not. They are people. And so something like positive or negative can work out just fine. Or I do have an STI, or I don't have an STI. So that works out. So how do you tell your partner that you have an STI if you have one? It's definitely easier said than done, especially if you like don't know the person very well. But the importance of telling people is that so that they can get tested and treat it and stop the spread where it starts. So different ways that you can tell somebody can be through text. I personally like text because I'm not very confrontational. However, you need to keep in mind digital safety. People can screenshot things and share things, and that could be not great. On the phone or through FaceTime or in person is typically best. That's what we recommend. But sometimes if you find yourself in a situation where you tell somebody that you have an STI and they get a little bit mad because that for one reason or another, if the situation just kind of starts to feel unsafe, you can leave. You've done your part. Now they know, and that's what matters. All right. So now let's talk about pregnancy. Pregnancy. If you learned in high school health classes, what happens when a fertilized egg embeds in the lining of the uterus? And then eggs become fertilized when they're joined with the sperm. Pregnancy can happen as a result of vaginal intercourse, embryo transfer, or artificial insemination. So there's many ways that you can get pregnant. And the options that people typically have when they get pregnant is keeping the baby and being parents. You can also adopt it out, and you can also have an abortion. And then the two types of abortion include medical or the pill that's typically done at home, and then surgical, which is done in a doctor's office. But typically it's a case-by-case basis. And it's usually just have a conversation with your doctor about what option is best for you. Something to remember is that in Colorado, the choice of pregnancy, continuance, or termination is solely up to the pregnant person and no one else. We're not here to advise what should be done, but these are just your options. And it's nice to know that you have a choice. All right, so that's good for me. And I'm going to hand it over to Lily.
Hello. So I'm gonna be going over birth control and barrier methods, different types of them, and how to use them. Yay! So the first kind of birth control that we're gonna be going over is hormonal, which how it works is that it uses hormones like progesterone, estrogen, or a combination to stop ovulation or to thicken the cervical mucus. If you remember Aiden going over how pregnancy works. Yeah, that's kind of how that goes. So examples are the pill, a vaginal ring, the shot, or a hormonal IUD. And then the non-hormonal birth control methods can either create a toxic environment for sperm, kind of like the copper IUD or spermicide, or can inform when ovulation is taking place to inform sexual activity, which is where ovulation tracking comes into play. So like I said, those are kind of examples of non-hormonal birth control. Then barrier methods, how they work is that they use a barrier, usually latex, plastic, or rubber, to prevent sperm and other bodily fluids from mixing. So this is where external or internal condoms come into play. And then abstinence, a little reminder that abstinence is the only 100% effective way to protect against pregnancy and STIs because you're not engaging in sex. So a little bit more of details into hormonal birth control. We have the hormonal IUD, the pill, the implant, the shot, the ring, and the patch. The numbers that you're seeing under each of these different types of birth control is perfect use, which is like the clinical trials when they were first researching it, making sure that everybody is following all the instructions to a T in a perfect setting. The typical use is kind of like the success rate for people who might miss a step or who might not be in that perfect clinical environment during the clinical trials. And then we have the kind of window of time of the maximum efficacy of these different kinds of birth control. So like the hormonal IUD can last up to 5 to 10 years, or the ring, which lasts up to 3 weeks, or the patch which typically lasts up to 1 week. Just examples of hormonal birth control. And the non-hormonal birth control, kind of like the copper IUD, fertility awareness, spermicide, and withdrawal methods, which is also known as pulling out. Something to keep in mind, as you can see, like the gap with the typical use is kind of wide between 77 to 98%. And that's because some people might use fertility awareness to conceive. So that's just something to keep in mind with that. Yeah, does anybody have any questions about any of these? Yes.
I heard that there's like, it's not on there, but I heard that there's like a weight limit on like the morning after pill.
We're going to talk about that in a second.
Okay.
Thank you so much for asking your question. So you can also compare methods using this QR code. Yes.
I heard that there can be like sperm in pre-cum, is that true?
Yes, there is sperm in pre-cum. Yes.
Follow-up question. Is it okay if I use like more than one of these at a time, or was that detrimental?
You can totally use more than one of these at a time. People typically recommend a non-hormonal and a hormonal form of birth control, just to kind of, limit the possibility of it. Thank you so much for your questions. Yay, we love learning. So emergency contraception stops ovulation from happening to prevent pregnancy. Emergency contraception is not an abortion pill. If a person has already ovulated, hormonal emergency contraception or the morning after pills will not be effective. If a person has ovulated and they obtain a copper IUD, the IUD may be successful in preventing sperm from reaching the egg, but it is not a guarantee. And for all emergency contraception methods, the sooner it is taken or implemented, the more successful it will be. But again, it's not an abortion pill. If you are already pregnant, it's not really going to do anything. As you can see, one of our lovely students asked about the weight limits. That's just how effective it is for that specific weight, but it just reduces it by like about 5 to 10% to my understanding. It doesn't necessarily change the lowering chance of pregnancy too much, but it's just something that we like to keep in mind when considering our options. Yes,
Is it bad if I take a Plan B after every time I have sex?
no.
If
Yes,
I'm above the weight limit, can I take 2?
no, please don't. Yes,
Can I clarify a couple of things?
yes,
Okay, so one, Lily said we can use multiple birth controls, yes. Not hormonal ones, like she said, I just wanna touch on that. So we're not taking like the pill and an IUD at the same time. And then for the Plan B every day, you certainly can take it every time you have sex, but because it only stops ovulation, and you could have already ovulated, it's smart to get a long-acting reversible contraceptive method like the pill or an IUD so that it lowers your risk of being pregnant. But there is no harm in taking it multiple.
Also, it's expensive.
thank you so much. So barrier methods and how-tos. So these are kind of what help protect against pregnancy and or STIs. Condoms, both internal and external, are the only contraceptive to protect against pregnancy and STIs. And then internal condoms can be covered by insurance if you get them prescribed by a medical provider. But if your goal is to prevent pregnancy, it is recommended to use the buddy system. So like we mentioned before, both Aurora and earlier, is a long-term contraceptive and a barrier method is the best recommendation. Just a thought. And these are different barrier methods. So again, just going over that perfect use and typical use for the external condoms, internal condoms, latex or rubber gloves are another option, and dental dams. So with the external condoms, they need to be used every time you have sex. You can use it for vaginal, anal, and or oral sex. But with internal condoms, it's the same. Internal and external. It just kind of depends. Take your choice. Typical use is different for both of these because they're different methods. And then latex or rubber gloves can be used to prevent STIs, but not pregnancy, because those are typically used for manual sex. And they can be cut into dental dams, so that's different. And then dental dams are used to prevent STIs, not pregnancy, the same way that latex gloves are. And they're used for oral sex for the vagina and labia, penis, or anus. Yes,
Am I extra protected if I use an internal condom and an external condom?
no. They can, if you use both, it can cause friction and break, which would lead to exposure of either thing that you may or may not be trying to protect against. Yes.
Last time I used a dental dam, I kept getting confused on which side was towards the genitals and which I was using my mouth with. How could I prevent that?
Great question. You can mark that so that way you can tell the difference between one side or the other side.
How would I mark it?
With a marker? Yes.
You can write a capital R on the right side, and then if it's flipped the wrong way, then you'll see that it's on the wrong side.
Thank you so much.
That's true.
Okay, now I'm handing it over to Aiden. Thank you so much for listening and for your awesome questions.
That's not saying.
Just kidding.
Theo. I know names.
Hi, it's me, Theo. I'm back. We're gonna talk about pleasure and communication, how to navigate it. Whew. Okay, so do remember that there is no right way to have pleasurable sex. It's about your preferences, your personal preferences, and the preferences of your partner. Pleasurable sex can look different for everybody, but here are some tips. First of all, learn what you enjoy on your own or with a partner. So if you've never masturbated, I highly recommend. And then you can figure out what you like on your own terms by yourself, and then you can express that to your partners. So next is communicate, listen, and respond. So before, during, and after sexual activity, discuss with your partner about what you like, don't like, and your limits. So to your comfort level, you can also provide gentle feedback during sex. It's not on the pamphlet, unfortunately, but it's called like the yes, no, maybe checklist, and it's just like a super long list of a bunch of different sexual activities, and you can go over it with your partner and talk about like, yes, I am willing to do this. No, I don't ever want to do this, and maybe we can do this like at certain points. So that's a fun activity that you can do with the partner to talk about your limits and what you like and don't like. And then next is to go beyond the orgasm. So remember that orgasm is not the end all of pleasurable sex. So sometimes there's this idea that like you have to have an orgasm or it's not like actually sex or didn't count, and like that's not true. You can still have pleasurable sex without there being an orgasm, but also remember that you can orgasm and like that doesn't make the sex done. So a lot of the times like in heterosexual sex, if the man has an orgasm and then he just decides that he's done, but that he might be leaving his lady partner unfulfilled. So orgasm doesn't necessarily denote anything because sex is about the journey. Pleasure is a journey, not a destination. And then lastly, we highly recommend including toys and also lube. So lube helps to decrease friction, increase sensation, increase pleasure. And toys can help with mobility challenges and increase overall pleasure. And they're also they can work with you. Toys are not your enemy, they're not your competition. They're supposed to be your friend. They're supposed to be something that you like collaborating with to bring a pleasure to your partner. Okay, and then these are all of the QR codes that we had throughout the presentation. Oh, hi, Cesar.
What kind of lube would you recommend for someone who is never bought any?
Well, I mean, it depends. So the thing with silicone-based lube is you can't use it with silicone toys because it like erodes. Water-based lube is good, but not for shower sex. I'm trying to think of like the different rules. Hi, Aurora, you have this one.
Yeah, so
Yeah.
water-based lube is probably the like quote unquote most comfortable option for people who haven't used lube before because it's easy to wash off, which is why it's not good for shower sex. And it's also keeps a pH level pretty balanced. Other forms of lube like oil-based lube can break condoms, so you don't want to use those. It can also cause vaginitis, bacterial vaginitis for some folks. And then the silicone-based lube is good, but it is hard to wash off. And you also don't want to use it for what you said with the silicone-based lube.
Sweet. Thank you. Okay, yes. Oh, just kidding. Hi, Abby, yes. Question.
So I know you guys offer sometimes like flavored lube. When would I use that?
Yeah, so flavored lube is to use for oral sex, but you should not use flavored lube if you're going to be doing any sort of penetration because if flavored lube gets inside you, you're more likely to get some sort of infection. So keep flavored lube on the outside of your body. Okay, so here are the QR codes that we showed throughout the presentation. If you want to scan them, have a chance. Thank you for joining us.